All right, it is 9 o'clock and we are going to start with our first keynote speaker. We have a great presentation for you. I am excited to have her joining us. And our keynote speaker is Dr. Solange Gould. She is the co-director of Human Impact Partners. She has a doctorate and a master's in public health, and she is a co-director at Human Impact Partners, which is a national public health organization that transforms the field of public health to center equity and build collective power with social justice movements. She brings over 25 years of public health experience working with impacted communities. Solange has worked to integrate health, racial equity, community power building into climate change, housing, transportation, land use, energy, labor, and economic security, policy, and planning. And her presentation title, as you can see, is a framework for operationalizing health equity. And just a little bit about her presentation, Solange will highlight the importance of a shared analysis of how racism, power imbalances, and other forms of oppression structure our systems. During her presentation, she'll detail how to establish change processes that embody a model of sharing power and center the voices of people who have been most impacted by the systems that we really want to change. Solange will also unpack the importance of relationships as a necessary tool to disrupt patterns of oppression at the interpersonal, team, and organizational and community levels. So it sounds like we're going to hear some great stuff from Solange. Solange, thank you so much for speaking at our conference. Really know all of this is so important, and I'm really looking forward to what you can provide our participants. So I will pass it along to you. Thank you. Oh, I do want to just let everybody know that Solange did put a comment in the chat box about a journal exercise that we'll be doing. So if you could just pay attention to that chat box, we would appreciate it. All right, Solange, the floor is yours. Thank you.
Good morning, good morning. Thank you so much for that intro. And I'm so privileged to be sharing this keynote with you on a framework for operationalizing health equity. Thank you so much for inviting me. Thank you, Trey and Josie, for your remarks and your dedication to health equity. And I love hearing you talk about power and community partnerships as critical to our work. And I also want to thank my colleague, Stephanie Tyrants, for supporting me during this talk, who is a past Nebraska public health professional who's worked many years to improve the well-being of Nebraskans. All right, so a little bit about Human Impact Partners. You heard some. I'm a co-director at Human Impact Partners. We are a national nonprofit based in Oakland that seeks to transform the field of public health to center equity and build collective power with social justice movements. We do organizing, advocacy, capacity building, and action-oriented research to confront the root causes of health inequities. I want to tell you a little bit more about myself, since we're about to spend 75 minutes together, and then afterwards as well. So a little bit about myself. I identify as an Ashkenazi Jewish white woman. I'm a mother of 2 young adult sons, one of whom is sleeping in the other room, as they will do. I am living with my partner and my 3 cats in Berkeley, California on native Ohlone territory. And I began working in community health centers when I was 19. I always knew I wanted to do something around health. And I was providing health services to families in rural Northern California and then in clinics across Oakland. And it was in clinics working on eliminating low birth weight, chronic diseases, and providing services in Oakland that I had my first conversations around racism and health and how powerfully racism shows up across the life course from preconception through death intergenerationally. And this work eventually led me to public health, because public health has a way of actually drawing people who are systems thinkers who want to actually try to prevent some of the suffering that shows up in clinical settings. And I've worked in 3 Bay Area health departments for 13 years and the California Department of Health Office of Health Equity for over 4 years before coming to HIP. I've done a range of public health programs, but I was most passionate about working with teen parents and their children. And These young families taught me to focus less on them and their bodies and behaviors, and more on how to help them to identify their power and engage with the multiple systems that were in the way of their ability to be healthy, such as affordable housing, education, transportation, economic policy, environmental justice. You can see them in climate rallies there, and structural racism. And some of these photos show the beautiful young families who shared their joys and their struggles and who eventually engaged in identifying and working on the root causes and acting on some of the conditions that were harming them, like education cuts, school sexual harassment, and climate change. And I am so excited to spend this morning with you, and I'm ready to dive in. So my charge for today is to describe a framework to advance health equity in our public health practice. And this includes an analysis of racial justice and power building, and as the root causes of inequities, and a description of the intersection of racial justice, power building, and public health practice. And our aspiration, I think, in this conference is that by grounding the work in a clear analysis of the root causes of health inequities, we're better equipped to identify the strategies required to achieve health for all. All right. I loved that Trey recognized this, and I want to also recognize that this work is led by people and that we also have different entry points into this conversation. And so I want to invite each of you to take care of yourselves and each other along the way during the next few days of this conference. This is hard work, and we want to stay in it for the long haul. We want to find the joy in this work. We want to have fun as well. And so I want to start by acknowledging that we've been through so many historic events in the last few years, cascading crises in the past 2+ years. We're in our 3rd year. We have witnessed and experienced so much suffering and loss. And you're coming into this context coming into this conference in a wider context that affects how your heart and body feel. Many of us have people that we are taking care of in the house. And this is not an easy talk to give or receive on Zoom. Normally, I could read your body language, see your facial expressions up close, and respond. So I invite you to take care of yourself, get comfortable, take a sip of coffee or tea, find your water, feel your breathing, feel your feet on the ground, and know that we are holding this learning space with love together. A few things about tech. Everyone is on mute for the plenary, but the chat is open, so people can chat in the comments, and I love the chats. They let me know that you're there. It's our way of speaking to each other. I very much welcome and appreciate chats and comments and questions while I'm talking. And like you heard, we will have 2 journaling activities in the middle of my talk and some shared reflections afterwards. And so please, if you have not now, go gather a pen and a journal or some paper and be ready to share whatever thoughts you have at the time if you feel so moved. I really encourage you to grab a real journal and a really nice pen. I know for me, my thoughts are different when I actually put pen to paper. And then we'll have some time, we'll have 2 times for questions and answers, a conversation. So in the first half, you can put your questions in the chat when I pause, and you can ask your questions in the chat. And then again, at the end, we'll have some time for questions. Feel free to chat your questions to the whole group. And if I don't get to them during the talk, you can re-chat them at the end. All right. I want to share a little bit of the assumptions that I'm bringing to this approach to building capacity to achieve health equity. When we say assumptions, we mean that these are the basis for our analysis and the content and tools that we're delivering today. And so I'm inviting you to try these on and believe these things to be true as you're in conversation with me today. So the first assumption I bring is that inequity is structural. Inequities are the result of structures and systems which have racism and other forms of discrimination baked into them. And these inequities cannot be solved by individual behavior change alone. It exists across systems, and we need our strategies to match the problem, which is structural. And so we focus our work there. We lead with an analysis of racism. We say that racism is in the groundwater. It's part of the way our society has been structured from the inception of the US. And doing root cause public health work requires naming the role of racism explicitly to create the conditions for health today. And all boats are lifted, and everyone benefits from the transformation of our systems to advance racial justice. And we also need to make it personal and figure out our personal stake in this work. and how we're all interconnected, and analyze and critique how and improve how each person in the system approaches systems change. And HIP brings in tools to create guardrails for trying this out in a work setting, many of which I will be using with you today. And I encourage you to bring back to your meetings and your work settings. And when we talk about power and the role it plays in upholding inequities, we're going to unpack a little bit more what we mean about power, but we're also going to talk about how we can use power building and power sharing approaches to transform who gets access to health in the United States. And then finally, health equity work requires deep organizational transformation and culture change. We are completely recreating what we do together and how we be together. And we have to create new patterns, practices, and ways of working and relating at multiple levels. And this requires having an adaptive leadership approach that includes taking strategic risks. And thank you, Nancy. I love that heart picture also. All right. So I'm going to jump into our theory of change of how to advance health equity in the US. And I know there's a big sunbeam behind me. I'm going to try to sit up straight. So as we all know, the dominant narrative of what creates health in the US is that the individual is responsible, right? People need access to medical care. They need to have good behavior. We have to watch what we eat, how much we move, whether we have safe sex, what we indulge in. And during the pandemic, whether we social distanced, got the vaccine, and masked. And all of this is very important. But in this framework, it's a lot about our bodies, what our genetics are, how our bodies change as we age, et cetera. And this is the dominant story in the US of how health is determined at this point in history. And almost all of us, including myself, kind of revert to this dominant story when we think about health. And you really saw that in the pandemic emergency, that really we got very, very focused on what we are doing with our individual bodies. And I think that the pandemic shifted this narrative a little bit as people have started to talk more about the bigger story about preventing the spread of the virus through income support and housing everyone who needs it, et cetera. But well before COVID-19, the data were telling us a much bigger story than access to healthcare. So the next slide shows that about 80% of what influences your life expectancy happens outside of the healthcare system. And this is there's an emerging health narrative, which has already been mentioned by Josie, which is that the social determinants of health drive our health outcomes. And it's a really wonderful change that we've made in our public health practice over the past 20 years, where more and more people are talking about living conditions, economic conditions, public services, and political, economic, and social conditions. And indeed, we saw the mainstream media talking about social determinants of health in light of COVID-19 and the glaring racial health inequities. And I'm so glad to see this narrative taking hold. And we agree that those outer rings of the ecological model are very important to focus our public health work on. And many health departments are grappling with this. And I think it's important to go even further. So let's just sort of do a little level setting. It's a health equity conference. So I'm going to give you our definition of health equity. Health equity means that everyone has a fair and just opportunity to be as healthy as possible. To achieve this, we must remove obstacles to health, such as poverty, discrimination, and deep power imbalances, and their consequences, including lack of access to good jobs with fair pay, quality education and housing, safe environments, and healthcare. All right, so here's the next slide is HIP's theory of change. And across the top, you see our illustration of a thriving community that is benefiting from health equity, all the social determinants there, where everyone has access to all the social determinants of health. And this is our vision for health equity, but we know our vision isn't reality yet. There's not housing access for all. Income inequality is actually worsening. Public education is chronically underfunded in communities across the US. And this is because the same inequities that we see in health outcomes are also present in every social determinant of health. So we can't assume that providing housing, for example, is going to solve a health issue, because even within the housing sector, there's inequities baked into housing policies that lead to inequities in the health outcomes related to housing. So indeed, we know that working on social determinants of health without paying close attention to inequities can actually increase health inequities. Traditionally, we often see that things that are provided universally actually can increase because people who have already some sort of advantage are able to take advantage of them even more. So we have to look at what drives inequities across all the social determinants of health. And our theory of changes at HIP is that these are driven by unequal distribution of power between communities, and those power imbalances are maintained by different forms of structural advantage and oppression, namely racism, classism, heterosexism, etc. And that those in power benefit from inequities and the status quo, and they push back against policy change. And we wind up with food insecurity and food deserts and lack of affordable housing and healthcare and justice being denied. So I want to say that unpacking all of this is uncomfortable. It can shine a light on ways we have been harmed or have benefited from the way our society is structured. So take a deep breath, and we're going to dig in first to what we mean by power imbalances and structural oppression. I'm going to start with structural oppression. It's a little bit of a wonky phrase, but I'm going to just start with it to get us more comfortable talking about it, since our work is about eliminating health inequities, which is innately about confronting the root causes in health inequities. So what is it? I want to say that many public health practitioners have made a deep and meaningful investment in understanding and addressing structural oppression in its many forms, and should take deep pride in that. Our field is often leading the charge in this realm across the country in various governments. That said, I do want to do a bit of level setting. So when we talk about structural oppression, we're talking about all the ways that we see hierarchies based on different dimensions of identity, where some people experience advantage in systems and others experience disadvantage. Some people get the callbacks for jobs based on their name, and we have a good body of research now to prove that these things are true. Some people never know what it's like to have the cops stop them for no reason. Some people never have to think about which bathroom to choose. Some people never have to think about having a fully stocked fridge. And not having to think about or worry about any of these things is indeed a form of advantage. And so structural oppression is the name for when we see dimensions of our identity shaping our experiences in the world. And so at HIP, we lead explicitly, though not exclusively, with structural racism as a predominant experience, because racial inequities persist in every system across the country without exception. We can't find an example of one system where there are no racial inequities and outcomes. And we also lead with race because when you look in within other dimensions of identity, such as income, gender, sexuality, education, ability, age, citizenship, geography, or place, there are also inequities based on race. Knowing this helps us take a more intersectional approach, while also always naming the role that race plays in people's experiences and outcomes more explicitly. So let's talk a little bit about a few definitions of racism that can help us make sense of what this word means. I like this first one. David Wellman simply describes racism as a system of advantage based on race. Another one that we like is by Dr. Kamara Jones, who's the former president of APHA and also a delightful human being, who defines racism as a system of structuring opportunity and assigning value based on phenotype, which we call race, that unfairly disadvantages some individuals and communities and unfairly advantages other individuals and communities, which undermines the realization of the full potential of the whole society through the waste of human resources. And what I want to call attention to is that she's not only focusing on the people who don't have access or the people who are unfairly affected by these systems, but she's also focusing on the folks who unfairly benefit or are advantaged from this system, namely white folks and light-skinned people. And I think it's really important to not only talk about racism, but to also talk about white privilege, white supremacy, and name the systems that are set up to benefit white and light-skinned people. And I want to define how I'm using white supremacy in my talk, because I know that word can be triggering for a lot of people. And I want to acknowledge that in the past, the term construed extremist groups like the Ku Klux Klan and neo-Nazis But now the term has entered the mainstream as a political and socioeconomic system where white people enjoy structural advantages and rights that other racial and ethnic groups do not. And entire aspects are shaped by it. And many white people are unaware that this system exists, which is one of its great successes, which is how it continues. And if you are a white person here, like myself, I very much encourage you to learn more about the political and socioeconomic system and culture of white supremacy, which is an important aspect of our work for health equity. It's really important to name systems of white superiority and advantage as much as it is to name racism and racist systems. And I am going to drop a few links in here that have been really educational for me, in case you want to do a little reading of your own. All right. A little bit more about the dimensions of racism. I think it's important to unpack that racism has various forms. This is one visualization of the various forms. We have internalized racism, which is racism within oneself, thinking positive or negative things about oneself based on all of the stories and stereotypes our society tells about our race. Interpersonal racism, which is bigotry between individuals or public expressions of prejudice or bias, like one person's attempt to exert power over another through oppression based on race. And then we have institutional racism, which is bias within any institution. It involves discriminatory treatment and unfair policies and practices. So for example, when a school system that concentrates children of color in the most overcrowded, underfunded schools with the least experienced teachers, it's the use of institutional policies and practices to exert power over others through oppression, privilege, and exclusion based on race. And then finally, we have structural racism, which is the cumulative racism and execution of power across institutions and society throughout history to the present that create systems of disadvantage for people of color while systematically privileging white people. And it's important to realize that structural racism is a set of processes that can generate disparities or depress life outcomes, even without any racist actors, because all of the systems are working in an interlocking way to make racism durable. So our work, so just an example of structural racism is think of the complex and multi-institutional school to prison pipeline. So you don't have to have racist actors. You can even have anti-racist actors with systems that are still producing racist outcomes. Yes, Emily, I'm hoping that others can help with that, with your request to make the links in the chat available. Thank you for that request. So I want to just end this slide by saying, at HIP, we primarily focus on disrupting institutional and structural racism. All right, so what do we mean by racial justice? Here are the definitions we use for racial justice, which we think of as both an outcome and a process. And as an outcome, racial justice is achieved when one's racial or ethnic identity no longer systematically exposes them to risks or grants them privileges with regard to socioeconomic and life outcomes. And it's when the people who need resources the most are prioritized to receive those resources. And as a process, racial justice is when those most impacted by historic and current structural inequities are leading and meaningfully engaged in systems change efforts. And yes, Two Rivers, we can, I will send you the slides for sure. All right, so we're gonna have a little bit of history because we always have to look back at our history. That slide doesn't show all of the slides that I mean. Oh, there we go. Might have been animated. Thank you. All right. So we always have to take a walk through our history. I'm going to talk about federal policy, but I always encourage people to look at their state and local policy. So I think it's really important to name how racism has been codified in housing, criminal justice, economic policies, and institutions and systems for decades, which even if they were passed 100 years ago, still have consequences and reverberate through to this day. So I'm going to start with the image on the left, which is the National Labor Relations Act, or the Wagner Act, which passed in 1935. And oh my goodness, we are coming upon where we will be seeing 100 years of this. This was a foundational statute of United States labor law, which guarantees the right of private sector employees to organize into unions, to engage in collective bargaining, and to take collective actions such as strikes. And when it passed, the law specifically excluded agricultural employees, domestic workers, government employees, and independent contractors. At the time, farm and domestic workers were predominantly African American, and their rights were traded away by FDR in order to appease and get the votes of Southern Democrats. And these exclusions remain on the books today, even though this law was passed in 1935. And today we see Latinx people disproportionately suffering the consequences of these historic labor exclusions because of how the demographics of farm and domestic labor have changed. So I want to talk about the middle picture now, and thank you, Kali, for sharing those links in hopefully an easier way. So the middle one, I bet you know, I've heard a lot about. It's redlining and the mortgage lending and banking practices that resulted from the Federal Housing Administration policies from 1934 to 1968. Otherwise celebrated for making home ownership accessible to white people by guaranteeing their loans, the FHA explicitly refused to back loans to Black people or even other people who live near Black people. This helped create wealth for white people and systematically excluded non-whites from home ownership, with implications for intergenerational wealth, segregation, local funding of education, disinvestment in neighborhood conditions, and all the resultant health effects from that. And we even have recent studies in the last few years, even in the last, I think, month, that look at redlining maps and our current health outcomes, and that there is still a correlation between redlined neighborhoods and current day health inequities. The New York Times had an article just a few weeks ago looking at air quality and overlaying it with redlined neighborhoods, and it's still a good correlation, a bad correlation. I want to talk a little bit about a personal story about how this played out in my family. My grandparents were both first-generation immigrants from Europe. They lived in the Lower East Side of New York. They grew up in tenements with parents who never learned to speak English. They only spoke Yiddish. They both served in, my grandparents served in World War II as medics. And when they came back from the war, they were able to receive loans and purchase a small house and move into a different tier of society and class and begin their racial formation as whites. My grandparents actually didn't identify as whites until much later in their life. And in my generation, I have a number of cousins who are now suffering from drug addiction, alcoholism, and joblessness. And when they have fallen upon hard times, they have been able to live in this house and rely on it as a safety net. And some of those same family members have fallen into the dog whistle racist thinking that signal them as white, and that they think they need to safeguard our public resources against the immigrants and people of color who are using the public safety net. And yet they don't remember this moment in our family's history when we relied on government funding that allowed white people to make our way out of poverty. So that's just a story that I think about quite a bit. And finally, in this last picture on the right, great book, recommended if you haven't read it, Michelle Alexander's The New Jim Crow, which outlines many public policies, but I'm going to talk about the policing practices of stop and frisk from the 1990s to the 2000s, which were the practice of detaining, questioning, and searching people based on a set of characteristics they believed to be associated with crime, rather than with credible evidence or information linking a specific person to a specific criminal incident. And so much data pointed to the disproportionate targeting of Black and Brown people in New York City that a federal court ruled the practice unconstitutional. And of course, The consequence of this practice remains for the thousands of people who already have arrest and criminal legal system records and being caught up in that system for decades, way beyond when this practice ended, and the intergenerational consequences on income, access to opportunity and jobs, family and community trauma, and all of the health consequences of that. And I raised these specific policy examples because we know that labor protections, housing, segregation, policing, and incarceration are major determinants of health for Black and Brown families, caregivers, and their children, but they have dragged the whole of our society down as well. And every one of us is worse off from these policies, even when we think we benefit. And I'm going to show you how in a minute. Thank you, Corstella. No-knock warrants are problematic as well. I think when we come to our Q&A, I would love to hear more about that. So let's have a little book club. Let's have some book group moment. I'm going to tell you about a few books we've been reading at HIP. The Politics of Whiteness and the Ideology of Upholding a Racial Hierarchy that sees Black, Indigenous, immigrant, and other people of color as less is actually harming white folks too. Thank you, Samia. Jonathan Metzl, a psychiatrist and sociologist, published a book a few years ago called Dying of Whiteness: How Politics and Racial Resentment is Killing America's Heartland. And Dr. Metzl explains the why of the primarily white deaths of despair that have been rising since 1999. Deaths by suicide, many times with a gun, and drug and alcohol poisoning. And his theory is that a politics of whiteness, both through voting for policies that further disintegrate our social safety net, like healthcare access through the Affordable Care Act, and through a narrative of mistrust of people of color and immigrants taking their privilege or resources away, is deeply connected to declining life expectancy for white men and to an increase in death by suicide using guns. Another book that we are reading at HIP is The Sum of Us by Heather McGhee. And in her book, Heather McGhee writes about a piece of American history that is a very apt metaphor for this same theme: how racist policies deprive everyone, including white people, of a better, healthier, and more prosperous life. Her central question in this book is, why can't Americans have all the good things that support us all, like universal health care and childcare, free higher education, et cetera, that other parts of the world have? The good things, she calls them the good things. And she answers this question with an analogy based on the real history of American swimming pools. The American landscape was once graced with beautiful public swimming pools like this one. I love this pool in the picture. I want to swim in it. It's in Montgomery, Alabama. And they were big enough to hold thousands of swimmers at a time. And these pools were the pride of their communities. They were monuments to what public investment could do, but they were in many places whites only. And then came the civil rights orders to desegregate them. The pools would need to be open to everyone. And these communities found a loophole. They could close them for everyone. They drained them, they filled them with concrete, and some shuttered their parks departments entirely. They did this across the country. But when they drained the pool because they didn't want to swim with Black people, who else didn't get to go to the pool? Wealthy whites set up a whole new system of private clubs and pools, but guess who else didn't get to go? The majority of white people also lost their pools. And this extends to many, many other examples. She's encyclopedic of looking through all the other examples in our society of public investments that we used to make, that we could make, but that we won't allow ourselves to make because we don't want people of color to have them, even though white people are also diminished, impoverished, and even dying from those lack of resources. She calls them drained pool politics, which is that if they can also have it, then no one can, which helps explain why America still doesn't have a truly universal healthcare system, a childcare system, a decent social safety net, or free higher education. And before I explain to you how my family benefited from the explicitly racist post-World War II mortgage lending policies, and that the next generation of whites in my family were shaped by this privilege and grew to believe that the safety net was only for people of color, and that it was okay to disinvest in the safety net, and that my white cousins have fallen on hard times themselves. But now the safety net is so thin and fragmented, and white people are affected as well by the consequences and real suffering from racism that was intended for Black, Indigenous, and people of color. And this is now seen in deaths of despair, decline of life expectancy amongst whites, the opioid epidemic, growing homelessness amongst whites. And my cousins now who need it desperately are also unable to find the services and the help that they need to thrive in their life. And this is about the real suffering that racism causes all people. And it gives a new meaning to the question of intent versus impact. The intent was to exclude people of color, and the impact was to degrade all of our living conditions and well-being. All right. I just gave you a lot of information to digest, including a lot of hard history. Let's go to the next slide and just the slide before, actually. Thank you. I want us to all gaze at this beautiful image of a chrysalis that is hatching and into a butterfly. I just gave you a lot of information to digest, including a lot of hard history. Some of us here in this conference experienced not being able to swim in the swimming pool in your family, in your ancestors. And some of us may come from folks who decided to drain the pools and move to private country clubs. And some of you may come from folks who didn't have access to private country clubs and also didn't have access to the pool. So whatever part of this history you come from, we are all suffering from the impacts today. We are suffering and dying differently. And let me be clear, people of color are absolutely suffering more from racism, but we are all diminished, and we are all dying younger, and we're all living with less. And we could all be thriving so much more. It's so clear that we're interconnected and that our fates are interconnected. And so, as is our practice at HIP, I want you to take a moment to slow down now. And when we're really talking about these big and deep issues, let's go ahead and take a few deep breaths and stretch. I'm going to stretch my arms and loosen my neck. I encourage you to go ahead and do so as well. Check where you might be holding on to stress in your body. Let's take a few deep breaths again together. Let it all out. Another one. Feel your feet on the ground. And reach for your journal. I'm going to ask you to do some work and some processing now. We're going to do some journaling. I am a big journaler. I taught my boys to journal. Now they're big journalers. I think it's a wonderful way to process what's going on in the hidden parts of our mind and spirits. So please now take out your journal and a piece of paper, and let's go to the next slide and look at these questions and write down your thoughts to whatever resonates for you here. Get your feelings down on paper, even if you disagreed with what I just said, even if you adamantly hated what I just said, just get something down. So we're going to stop for 5 whole minutes and free write your thoughts about the questions on the screen. I hope you have a lovely pen. A good pen is all the difference in the world. And then we're going to take a few minutes to process as a group. And I'm going to ask for anyone who feels moved to share any reflections you have for the group in the chat. And so I'm going to read the questions out loud. How has drained pool politics played out in your personal story, such as in your own opinions, your personal narrative, or your family history? How has drained pool politics played out in the places you work? How does this history show up in current health inequities? And how can you use the metaphor of drained pool politics to advance a health equity narrative in your work and bring more champions along in the fight for racial justice? So I'm going to start the timer, and we are going to encourage, we're just going to free write. Please write about whichever parts of these questions resonate for you right now, and then we're going to share reflections. Just a minute left. We're gonna come back in a minute, so feel free to tie up any thoughts. Okay, that was 5 minutes. Isn't it amazing how 5 minutes can feel so long when you're doing something like journaling? I would love to have people share their reflections if they're comfortable in the chat. Let us know a little bit about what you wrote about. What did your journaling about this bring up for you? And I appreciate Chris Stewart dropping something in the chat early on about how racism, about how racism, how it affects us all is thought-provoking. The Brain Injury Alliance of Nebraska doesn't have criteria to work with individuals living after brain injury or family members. My thought is that while we don't collect data on race, we serve few minorities that may be living after brain injury. And then Jeannie Weiss, in an effort to keep them from accessing healthcare benefits, process for applying for Medicaid was made extremely burdensome. Limited access to support between 9 to 4. Yep, instructions only in English. Need to reapply every 6 months. Computer system portal crashed. Phone lines would disconnect. Wait times excessive. Thank you, Jeannie. Any other comments? Please keep them coming. Any questions? I'm also interested in questions this raised for you. I'm going to wait another minute and see if there's other comments that are coming up for people. All right, let's move to the next slide. All right, Teresa. I'm a first-generation college student who just graduated with my MSN. Congratulations. We need to fight for higher education equity. Yes, it is a public health issue. Thank you, Teresa. All right, so we talked about drained pool politics. We wrote, we journaled, and I want to say that before that, in the 1970s, Indigenous activists were naming this truth, that we suffer together, our fates are linked, and we are inextricably interconnected. Our planet, our democracy, our economy, our education, our spirits, our health, and we must approach equity work from a place where we are clear about what's in it for us, not from a place of charity, not from a place of feeling bad for populations that have worse outcomes, but because we all need to get free from structural racism and structural oppression. And we can all get free together. So I'm going to stop here for a minute, and I am appreciating all of the chats. And I want to hear some of your questions and comments. And so if you want to give us some of your thoughts, ask a question about what I've said so far, please drop them in the chat. We can take a little bit of time to unpack everything I just talked about before I dive into the next half of my talk. So more congratulations to Teresa. Thank you, Danielle. Differences among people bring change. Without change, there is not growth. Thank you. And Corstella, I think drained pool politics is an opportunity for my white colleagues to amplify their voices in spaces where BIPOC are not present. Thank you for this conversation. And then Betty, affordable healthcare is not affordable. That is very true. Anything else? Questions? Please drop them in the chat. We can pause here for a minute. Let's have a few more comments from people. Teresa, much of the affordable healthcare does not comply with the ACA. Teresa, if you want to say more about that, I'm curious. Medicare is not compliant. Thank you. All right, I'm going to move us into the next phase of our talk. All right, wait a second. There's a few more. What would be your advice to start the process for health equity? I really like that question, and I'm gonna ask Jessica G to bring it up again at the end, because I have a few things that I am going to offer next, but I want to come back to that question. And we also have a breakout after this that is going to be a little bit more about how to operationalize this. Chris, just like healthcare, is education a right or privilege? As part of the Bible Belt, if instructed to do so, the least of these, how are the community supports living our better selves? The poverty from lack of care and learning. Thank you. I agree. Education is a right. Some self-funded plans too. Again, Teresa, around healthcare. Betty, we have the privilege to work with an ally who uses her white privilege to fight for the unheard. And then Jeannie, when we see drained pool politics happening, how do we bring light to the issue? I worry that by calling it out, some may dig in their heels and double down. How do we get those drained pool thinking to move past it? I'm going to stop there and say that I appreciate this question, Jeannie. I have found, we work with health departments across the country at the federal, state, tribal, and local level. And I think that what I have seen is that when leaders in health departments start to name it and encourage their staff to look at it and how it's playing out in their jurisdiction, in their work, that it actually gives it breathing room and sheds light on it. And there are people that will double down there, and we're seeing this in our country, right? There's no doubt we are seeing a polarization happen. But I want to talk in my when we move into breakout sessions, we're going to talk a little bit about tipping point theory and taking great risks. And we're going to talk a little bit about how we don't need everyone to come along. We would like everyone to come along. But if you look at the way ideas diffusion of innovation theory, that actually you just need a critical mass to get tipping point. And that the tough conversations, as Jessica says, these are tough conversations that need to happen more often. So I encourage you to come with love for people. And I think if you come with love, these tough conversations can be very, very hard. I don't dismiss how hard these conversations are, but I think they are important to have. All right, Jewel. Working previously in an urban elementary school with the majority of students being BIPOC and the majority of staff being white, including myself, where the school and community was highly under-resourced and under-supported, while the students and families in this community were the most negatively influenced, the white staff were also negatively impacted. There was little satisfaction from their work because of all the struggles they're experiencing with their students, significant vicarious trauma, and negative impacts on mental health. So everyone in that setting was reduced. I appreciate that, Jewel. Thank you for that example. Agreement with Jessica. And then Catherine, the drained pool analogy helps to illustrate the loss to our communities and how helping more people really helps all. Corstella, racism is a public health issue. How are you engaging in this discussion around structural oppression with diverse audiences? I find it difficult to call things out explicitly. Thank you for the talk. And Kali says we're gonna keep tracking. And thank you about bringing love. Thank you, Virginia. Yes, more love, more joy. This movement should be joyful, you guys. We need to bring the joy. And we need to recognize our pasts from Sharon and then quit blaming and shaming and move forward. I agree. Samia, I hope I said your name right. This is a tough and heavy topic. What is your advice on how to safely help clients who open this conversation when they vent out to us besides being an active listener? This is a good one. Samia, I want to talk about power next. Because I think that when we have one untapped thing that we have in public health is our services and the people who come for services, for public health services, and how do we not just listen to them, but plug them in to ways to actually join together and be powerful together. So I appreciate all these questions. I'm going to keep going. I'm looking at the clock, and let's keep moving, and we'll come back to some of these questions if you don't feel satisfied at the end that we've talked about them enough. All right. So now what I want to do is talk about the other side of what we think determines health, which is power imbalances. And the relationship between power imbalances and structural oppression is closely intertwined. Any attempt to address structural racism is in and of itself an attempt to redress power imbalances. And so it's important to name them independently. The hierarchies based on forms of identity are meant to reinforce a system in which some people have better access and advantage and others don't. So back to what we talk about in this next part is power. And so what is power? We like this definition from Dr. Martin Luther King Jr. Power, properly understood, is nothing but the ability to achieve purpose. It is the strength required to bring about social, political, and economic change. And I want to say this quote is from Where Do We Go From Here? Chaos or Community, which I also just reread and is really startlingly still very, very applicable, the writing in this book, which was written in the 60s. When the balance of power is grossly out of balance, that means that one group has enormous capacity to shape laws, make meaning, and repress anything that threatens their hold on power. And I want to highlight that power is not inherently good or bad. Most of us in this field somehow think of power as bad. It's power over, power to oppress people, etc. Power just is. I think of it as like air or water. It's operating everywhere at all times in every situation. When my kid wakes up this morning, I'm going to exert power and tell him a few things that he has to do around the house. Power is just the capacity to achieve a purpose, and its value depends on its locus, purpose, and manifestation. So perceiving power as bad can limit our ability to recognize that we have a role to play in pivoting its use towards good purpose. And I want to highlight a few frameworks or definitions for how to break down power into its different components. And so we often lean on a framework developed by the Grassroots Policy Project to define power in its parts so that we can start to see the various aspects of power and use them to our advantage in our work for positive change. So the first thing we need to do is start to make power, which is generally invisible, visible, and to identify when we see it operating so that we can use it. So the first face of power I want to highlight is the power to win a specific election or a specific decision. This often means organizing people and resources for direct political action to get involved in a political process, to pass a law, to elect someone. The vast majority of campaigns and organizing and electoral work that we see today is focused on this dimension of power. And this dimension of power cannot be underestimated in today's climate of voter disenfranchisement that is linked to a racist agenda and suppression of the decision-making power of communities of color. And a lot of public health organizations have made the right to vote one of the social determinants of health that they work on in a nonpartisan way. So in answer to your question, Samia, this is a way that we can connect clients to a way to become empowered and organized is by connecting them with local community organizing groups. So the next dimension of power is the power to set the agenda. This relies upon building an infrastructure and a network of equity actors to shape that political agenda. And movement building is about this infrastructure building. And we all are a part of a health equity movement. How do we channel individuals into sustained long-term political engagement towards something bigger than one narrow win? And many people are starting to understand that we need to organize organizations into durable and deep alliances that can accrue their power to win fights. And if we can build our collective infrastructure, we can set the agenda proactively. For public health, this means building long-term relationships with other equity champions across government, with electeds, and with community organizations, and especially with community power building groups or community organizing groups. we cannot do this work of health equity alone. We have seen that in the last few years. There will be pushback, exactly what was described. There will be a lot of, we've seen pushback in public health. I know all of you have been following that very closely. We can't do this alone. We need to build out an ecology of health equity champions through all of our work, our health and all policies work, partnerships with community organizing groups, electeds, and nonprofits, so that we can proactively shape an equity agenda, and the universities. So thank you for the universities for being great hosts. The third aspect of power is the power to change and hold public narrative. It's about making meaning of the world and our own place in it as individuals and communities. This is about shaping conscious and unconscious understanding in ways that help or inhibit people's ability to ask questions. So this includes what people think is meant by fair and optimal living conditions, who has the right to health and opportunity, and the role of government to implement these things. This form of power is long-term, it's the hardest to influence, and it's also the one that we in public health have access to right now. We can help shape people's ideology and worldview by what we say, what we talk about, how we frame things, what questions we ask. And then we can shape what people think, what we think is possible, what people think is possible, what people, how people think health is produced, who is deserving of health and well-being, and how the world could or should even work. And we've been working this year with groups across the country on creating a transformational health equity narrative that can shift what we think is possible. They're going to apply it in campaigns by shifting people's narratives of how we make meaning of the world and what change we might be able to win. Quick stop here to talk about intersectionality. Here's Kimberly Crenshaw, who coined the term intersectionality, which she says in this quote, is simply about how certain aspects of who you are will increase your access to the good things or exposure to the bad things in your life. So power dimensions are not static. In the next slide, you can see that power can shift along dimensions of identity like gender, class, education, and immigration status. You can feel disempowered based on one dimension of your identity, and you can feel empowered based on another dimension of your identity. And we're all living at the intersection of these many identities. Every person is moving through the world, switching in how they engage in the world based on what's valued and what's privileged in our culture at any particular given time and context. And the same is true of organizations and institutions and the leaders in them. And that is why we need to identify when and where we have power as organizations and leaders, so that we can call on that ecology of actors to step in when we don't have power to make the good changes we're seeking. And I want to say that we saw in the next slide, a very important thing that we learned in the last few years is that strong, long-term, trusting relationships between public health practitioners and community organizing groups are essential, foundational to achieving health equity. They provide strategy and mutual accountability. They provide us with political cover when we most need it. And we saw health department use each of these three faces of power that I just went through during the pandemic to win campaigns, to set an agenda with a network of other organizations, and to change the narrative about what is health equity and the solutions we need to get it. So how is it that these things end up having such significant health impacts? Well, because of the ways that these power imbalances and things like structural racism pattern the environments and communities that we live in. Who gets to live near pollution sources, who gets good transit, who has high quality housing, whose streets are paved, who has clean drinking water, who has heavy police presence, who has grocery stores. All of these things have an indirect effect on our health, and all of these systems are patterned by structural racism. So racism also, though, gets into the body directly through chronic experiences of racism and other forms of discrimination. These get into our bodies through chronic experiences of stress. Being stressed, acutely stressed for short periods of time is not necessarily bad for our health. Fight or flight, it can be a life-saving instinct, but it's when our bodies can't get a break from the stress, specifically through chronic experiences of discrimination, that health impacts become ongoing and harmful. So conversely, I think many of us understand the body of work that this slide is referring to, which is a higher with experiences of stress that are shown all around the body. Our allostatic load increases and all of our systems of our body, every health supporting system weathers or ages faster. Even our genes change structure, which are passed on genetically to our children, even in utero. Conversely, exerting power over the decisions and systems and environments that affect your life has a beneficial impact on your health, both through creating more health supportive living conditions, but also through the exercising of agency. Being able to have agency or decision-making power over the conditions that affect your life seems to improve your health directly. Again, that's why many public health groups are now directly focused on voting, voting rights, organizing, and the ability to vote as a health determinant, and working on it knowing that they are not crossing the line into lobbying or advocacy, but simply providing an essential good that is as important to health as housing and jobs are. So I want to say that Human Impact Partners is one organization based in California. You're hearing from us, but you may not have heard of us, but I want to say you're part of a growing movement across the health sector. You're doing this work along with the American Medical Association, APHA, NECHE, the American Academy of Pediatrics, Federal Maternal and Child Health Branch, et cetera. All of these associations are reckoning with the history that their own organizations have had. The AMA put out its statement last year of its own legacy of disallowing Black physicians from joining the association decades ago. The American Academy of Pediatrics put out a piece talking about how racism harms child growth and development. And these conversations are happening across the health sector, across the country, with an explicit attention being paid to structural racism and other forms of oppression. So when you're trying to have this conversation, you don't need to be in there alone. You can always reference these other organizations, and that you're part of a movement, that you're part of a public health movement. So the next slide, I want to also highlight the Government Alliance on Race or Equity, or the GARE. Many of you have heard about it. You may even be a part of it. It's a national network of government agencies working to achieve racial equity. It's not just health departments, but it's all of government working to normalize, organize, and operationalize actions to achieve racial equity within government. This is an older map of the jurisdictions involved in GARE, and I know there are even more today. So bring all of these visuals and all of the others who are working on this along when you're having these conversations, so that you don't feel alone. Next slide is just a quote that I appreciate so much from incredible poet Audre Lorde. "You do not have to be me in order for us to fight alongside each other. I do not have to be you to recognize that our wars are the same. What we must do is commit ourselves to some future that can include each other, and to work towards that future with the particular strengths of our individual identities. And in order for us to do this, we must allow each other our differences at the same time as we recognize our sameness." And some of you chatted similar things in the chat. The next slide I want you to do after this, which is a journaling again. There's a lot to unpack in what I just talked about around power. And so I want you to write these questions down in your journal, and I want you to journal about them later. What does it feel like to hear words like power, oppression, racism, even white supremacy in relation to what it means to advance health equity? Where did you feel challenged, and where did you feel affirmed? And if you feel moved right now, you can write your reflection in the chat. So today I proposed a framework for what it means to advance health equity. It's a framework that really speaks to the root causes of health and well-being. And yes, Sharon, the slides will be available. This framework that I presented speaks to the national reckoning and the movement that we're in right now. If we can go to the next slide, I want to say that I'm sure you're all having many feelings and reactions to this content. In my experience with working on and talking about racism in public health, some of us may be sitting with some discomfort, and others may be feeling some relief and freedom to hear these things said out loud. But what's important is having this conversation collectively in our workspaces so that we can attend to the work of making sure that everyone has the conditions to be healthy. And in practice, this is about creating a shared analysis of how racism and power imbalances and other forms of oppression structure our systems today, about changing how we're in relationship with one another and with ourselves, and about modeling power sharing and centering the voices of people who have been most impacted by the systems we seek to change. We're going to talk, Stephanie and I are going to talk about the many ways to operationalize this in our breakout session later this morning. I want to say I love this image. Nature reminds us of the aspect of our work in which we are in a process with no end. There's no set arrival point. It's a constant state of change that adapts to new information and that gains wisdom and insight from dynamic conditions and perspectives. Growth is constant. Even if it doesn't feel like growth is happening, growth is happening. Conflict is inherent in this process of transformation and should be welcomed as a sign of change and growth. Shifting power to be collectively dispersed across people and communities and toppling the hierarchies that assign value based on identity or social position is no easy process. It will take a vast network of brave systems change leaders, all of us, and movers to guide us towards truth and reconciliation, justice and health and abundance. And so we have just a few more minutes. I'd love to hear more of your questions and comments right now. I'd love to hear more voices and your thoughts. If you have a question, please raise your hand and we can unmute you and you can speak with your voice. And you can also put your questions in the chat if you want. So if you have a question or a comment, please raise your hand and we will be able to see you and unmute you.
Solange, this is Josie. I do want to highlight that I want to make sure that we got to some of the questions in the chat. I know that one of the questions that you wanted to come back to was the drain pool politics and just how do people bring light to those issues? What are some ways that they can do that? And then I'll also look for other questions that come up as well.
Yeah, so the drained pool politics, so Heather McGhee wrote this book. She is a Black woman. And this is my personal analysis. I don't think that she needed any convincing that racism harms everyone. I think that she went about this book as a great narrative project. And now you know what I mean by narrative, which is the power to change people's ideology. And so drained pool politics is I think, a great narrative power tool to talk about your own experiences of drained pool. And, you know, in the rules of communication, we know that I statements are really important. And that's why I asked you to journal about drained pool politics, because I think once we become more clear-eyed and more articulate about how we ourselves, either personally, in our family history, in our work, in our history of our jurisdiction, and when we become more clear about how we also are working against drained pool politics and health equity, and you speak about it as your own analysis using I statements, I think it's a very effective way to start a conversation. Those slides will be available to you. You can do it during staff meetings. You can talk about this during staff meetings. I welcome you to use any aspect of my talk today to start to have these conversations in your workplaces. And it is not easy. And so take care of yourself. Do kind and joyful things to care for yourself. I want you to also care for your staff. We don't get enough care in the workplace for this very hard work. So I hope that helped answer that question.
Okay. That did, and I can't remember, I might have missed it, but did we address the question about your advice on how to safely help clients who open this conversation when they vent out to us, besides being active listeners?
Yeah, I very much appreciate that question too. I want to say that I worked in client services for many, many years. And I started my talk with my photos of the beautiful teen parents who taught me this lesson, the exact lesson that you're asking. When I listen to, when in the past, when I would listen to clients talk about the experiences that are affecting them, there's a few things, there's a few shifts that I think are very powerful in service delivery. One is moving from, is offering groups. And many services are starting to offer groups. You've heard of maybe Centering Pregnancy, which offers pregnancy services, pre and postpartum, as well as now pediatric services in a group setting. And the outcomes of those group settings are that people actually start to talk about the conditions that are shaping their lives. In this case, maternal and child health conditions. They start to talk about housing. They may be talking about their own safety, violence, economic security, and many of those things. And what happens in a group is you see that you're not alone, number one. But number two, you can start to lead clients in a group setting towards those sort of methods of root cause mapping. So with the teenagers, I used to do that. So what is going on? Why is I'll just call it out. Why is Berkeley High not signing you up for AP classes or college preparatory classes when you're a straight A student? This was a conversation, an example of a conversation. And we would get to the root cause. Oh, why is that happening? Well, why is that happening? And then the answer. Why is that happening? And then the answer. And so through this, they start to identify the things that are affecting them and the decision makers that could be sought out. And through this sort of method of helping them identify why, they became very politically active. They approached their principal, they approached the counseling, the high school counseling system. They went to protests around school education cuts. They protested sexual harassment that was happening to them at the schools. And so I think they learned through that method how to organize and how to basically become much more powerful as young marginalized people in our society. And so I think there's enormous potential in turning individual services and offering, in addition, some kind of group setting. At the very least, if you're not prepared to do that, because I know that we're all up against resources and time, there are community organizing groups in your community, in your jurisdiction, who will do this, who can do this, who can connect them to voting, who can sign people up to vote, who can connect them to how to speak at their city council, at the board of supervisors, et cetera, to become politically powerful together. So I hope that helped answer a little bit about that question.
Yes, it did. Thank you. And one other comment I just want to mention by Lucia. She said, drain pool politics also remind me of parks and lakes that were built on Black communities. Mm-hmm. It makes me think of community, of who is granted access to community. Who are we creating spaces for, and who are we destroying communities for? Mm-hmm. I thought that was an interesting comment.
Yes, thank you so much. That is a very important and tragic part of our history that continues. I mean, highways, we can say the same thing. Highways were built through communities. Housing was taken down in vibrant communities to put up other housing. So that's kind of goes back to the question of when we work on social determinants. If we don't work on social determinants with a clear eye to our history and to racial equity and justice, we can cause extreme harm. And part of what we help governments do is to listen, and to actually listen to communities and to hear the harm that's been caused by government, that's at the root of community distrust, right? I think it's important, just like this conversation is hard, it's important for government to show up in the hot seat. And I've been in that hot seat, I know it's hot, and to come with humility and listen to the harm that we've done, because that's the first step in repairing and gaining trust and building power together. You have been an amazing bunch of people to spend the morning with. I have appreciated your chats and your questions so much. I'm going to just take a second so we can look at the chats. These are beautiful chats.